moves. Claudia, now to you.
Okay, JC, thank you. Topping this morning's health headlines, it's very interesting. A treatment being used right here in South Florida. It's credited for results in children with autism. It may sound unusual to you. We're talking about the use of hyperbaric chambers, which usually in this area we see used on divers who suffer the bends. But today we're talking about a center which is now using this to treat patients. And Hope Fine is joining us right now from the South Florida Center for Hope in Deerfield Beach. Can you tell us how this works now? What kind of autism are we talking about?
All types of autism.
All types of autism. And you actually put a child in the hyperbaric chamber.
Correct.
Is it because of the increased oxygen? How does that work?
Well, we know that these children have some decreased blood flow in certain areas of the brain that part of the brain that controls their socialization and their eye contact and their speech. So this actually is encouraging new pathways, new connections, getting oxygen to those areas. And we know that these children have swelling on the brain. The oxygen decreases the swelling as well.
Now, tell us what kind of headway you've actually seen. Children who've had the treatment and you've noticed that they've actually progressed.
Unbelievable. These children have come to us that have never spoken before. They've had no eye contact before. They've been completely out of control. And after a couple of days, they get on the bed by themselves. They go in. They love going in. Within a couple of treatments, their parents will notice a difference in them right away with their eye contact, their attention span. Their teachers notice the difference. And after a few weeks, they can start to speak.
Now, medically, I know there's been some good buzz about this, but it's really not proven per se yet. Does insurance cover this?
I have been able to get some insurance companies to reimburse. So yes, we have been lucky.
There aren't too many hyperbaric chambers around, so this isn't something I would think would be in wide use at this point?
No, they aren't widely used yet, but more centers are opening. When I opened up about 12 years ago, there were very few centers in the United States, and now there's probably 200 centers in the United States.
So Hope, what do you see as far as the future, as far as treating children who have autism with the use of hyperbaric chambers?
Chamber. It's a clear cylinder, a clear chamber, and they're on there. They watch their favorite video, and they feel better when they're in there, and they roll around in there. They love being in there. So this is a big piece of the autism puzzle. There's a special diet that some of them need to be on, and supplements, and ABA, which is behavioral therapy. All of these things are all part of it, but this is a very big piece of the puzzle.
Now, the worst that could happen, I understand from this, is it wouldn't work because there's no really, no health threat from this, correct?
Really, no health threat, no, because it's not invasive. Really, is not invasive. Yeah.
So any parents right now who are watching and have tried just about everything else, what would you say to them this morning?
Give us a call. We'll give you some information. Come visit us. I do very little advertising. I tell the parents that call, just come to my center, sit in the waiting room, and talk to the other parents, because they're my best advertisement.
Okay, where are you, and how do we get a hold of you?
We are in Deerfield, and they can go up online and just look for Hope Hyperbaric in Deerfield Beach. That's the easiest way to find me.
Very nice to meet you this morning, and I hope this helps so many children.
It does, it really does.
You're here very early, Hope. Thank you so much.
You're welcome.
Okay, JC, back to you.
It's an interesting treatment. Okay, Claudia, thanks. Doctors, meanwhile, may now have a new